So welcome everyone to The Whole Itself Remains. I'm your host, Todd Caldecott, and you're listening to CJMP Co-op Radio 90.1 FM, broadcasting from the Qathet region on the beautiful Sunshine Coast of British Columbia on the traditional territory of the Common People. This show is part of a weekly live Q&A series where subscribers join me each Wednesday to explore health, healing, and human wholeness. And after the broadcast, we dive deeper into a 30 to 60 minute Q&A where subscribers can ask me anything, clinical, personal, or even philosophical. So for today's show, I'm focusing in on dementia, primarily Alzheimer's disease. This is a topic I've lectured on fairly extensively, most recently at York University in Toronto during the CSNN conference this past May. My approach integrates clinical experience, traditional practices from Ayurveda and other herbal systems, and a deep engagement with the scientific research on dementia. While the subject is vast and can't be fully addressed in a single hour, my aim is to offer a genuinely holistic perspective on this major global health issue which affects an estimated 50 million people worldwide and ranks among the top 10 causes of death. I'll provide a brief overview of its causes and manifestations, explore various theories on its origins, and discuss key therapeutic interventions to support and improve cognitive function. Most importantly, we must remember that once overt symptoms of dementia appear, treatment is often too little, too late. That's why it is critical to recognize the early, subtle signs of cognitive decline and take proactive measures to delay or prevent its onset and support healthy brain aging. Okay, so let's dive right in. So what is dementia? It's a general term used to describe a progressive impairment of memory, cognition, and behavior. This affects an individual's ability to function normally. The most common cause of dementia is Alzheimer's disease, but it can be related to other pathologies, including cerebrovascular dementia, Parkinson's disease, Lewy body dementia, frontotemporal dementia, Huntington's disease, traumatic brain injury, viral infections such as HIV or COVID, bacterial infections such as Lyme or syphilis, and then prion disease such as Creutzfeldt-Jakob disease, the so-called mad cow disease. And the term mixed dementia refers to features of a few different pathologies that can manifest simultaneously, such as Alzheimer's with Lewy body dementia or Alzheimer's with vascular dementia. Typically, it is a multifactorial causal picture that we're looking at and that we need to address. So Alzheimer's disease is the most prevalent form of dementia. It was first described in 1907 by Dr. Alois Alzheimer in a 51-year-old female patient that suffered from a severe form of dementia. And upon autopsy, he noticed the deposition of, quote, a peculiar substance in the cerebral cortex, unquote, which was later determined to be a 40 amino acid protein fragment called amyloid beta protein. He later published a research paper, and then his findings replicated, and then so-called Alzheimer's disease became a recognized pathology. One of the important things to understand about Alzheimer's, however, is that it can only be definitively diagnosed post-mortem. So if someone is suspected of having Alzheimer's disease, we would define them as having a probable case of Alzheimer's disease because we can't actually confirm that until autopsy. So the clinical features of Alzheimer's, and this is the most prevalent form of dementia, it includes disturbances in comprehension and language, confusion, poor memory recall, difficult speech, altered judgment, impaired abstract thinking, a feeling of not being oneself or a loss of interest in favorite pastimes. So this feature of anhedonia is important to note as we age, diminished creativity and ability to express affection or experience pleasure, that anhedonia as I mentioned, various language disturbances such as using filler words, an inability to express thoughts in written form or comprehend the written word, difficulties in performing everyday physical tasks such as dialing the telephone or unlocking the door, and then other general behaviors, maybe a deterioration of personal hygiene, inappropriate dress, a loss of social graces, losing and misplacing items, repeated traffic accidents, irritability, stubbornness, suspiciousness and paranoia, a short attention span, an inability to perform simple instructions or an obsessive attention to trivial matters. So, I mean, all these things can happen in all of us just on a semi-regular basis. Like, for example, if you woke me up first thing in the morning, I probably would display some of these features. Likewise, if it's late at night and I'm really tired, or if I'm under the influence of some substance, then likewise, I might express some of these symptoms. So, we have to understand that these aren't just very periodic or one-off symptoms, but they're a clinical picture that seems relatively prevalent and continuous, and so needs our attention. And we need to pay attention to these as they begin to manifest in their subtle forms, particularly when they're chronic. It's important that we undertake a differential diagnosis because while these are features of Alzheimer's disease, there are also features of other conditions. So the differential assessment would include ruling out things like multi-infarct disease, Parkinson's, depression, alcoholic dementia, hypothyroidism, adverse drug reactions, vitamin B12 deficiency, or infections such as syphilis or HIV. And once again, it can be multifactorial. So as I mentioned, dementia affects about 50 million people worldwide, of which 60 to 70% of cases are diagnosed as Alzheimer's. The current prevalence of dementia is more than double the estimated number of cases in 1990, so it's increased now to be one of the top 10 causes of death. It's most commonly found in people over the age of 65, and it increases with each succeeding decade, such that nearly half of people above the age of 85 suffer from some form of dementia. And although the risk of dementia increases with age, it can occur before the age of 65, and this is what we call early onset Alzheimer's disease, and this is the most worrying form because it's devastating and dramatically shortens lifespan. Interestingly, the incidence of dementia appears to be increasing in low to middle income countries, whereas in developed nations, the rate of dementia appears to be slowing. And one possible reason for this is increased education. This results in what is called a greater cognitive reserve. So basically, this whole philosophy of if you don't use it, you lose it. But if you use it and you enhance it and support it, this seems to have a protective effect against dementia. And women actually have a higher risk of dying from Alzheimer's disease than men, particularly in the population older than 85. And this is explained mostly because of the greater longevity in women. There's basically 2 women for each man over the age of 85. So, men tend to die at an earlier age, and therefore there aren't as many over the age of 85 suffering with dementia. Also, the brain-related changes of Alzheimer's tend to be more severe in men, and so women are more likely to express features of clinical dementia because men will suffer a severe form and die at an earlier age. Also, the worst prognosis for women that sometimes occurs is because of an overall higher cognitive reserve than men. So when women start exhibiting symptoms of Alzheimer's disease, the degree of neurodegeneration is more progressed. So because women generally have a higher cognitive reserve, there is such a greater, more profound difference between their former cognitive abilities and where they're at this particular juncture if they're suffering from dementia. So women live longer, so therefore at higher risk of dementia, and then have this higher cognitive reserve, and so the effects of the decline of dementia can seem more severe. So the pathogenic factors of Alzheimer's relate to the atrophy of the cerebral cortex. This is due to the death of billions of neurons. And upon autopsy, there are 2 primary distinguishing pathological features: the formation of plaques within the interstitial spaces between neurons, and then the development of what are called neurofibrillary tangles within neurons. So this waxy substance, these plaques occurring outside of the neurons that impairs their function, and then these neurofibrillary tangles that occurs within the neurons themselves. Let's talk about these plaques, also known as amyloid beta. These are tiny waxy deposits made of this amyloid beta protein and also varying degrees of inorganic aluminum. And these accumulate in the interstitial spaces between neurons. And it appears generally that these plaques correspond with the severity of dementia. And so that has made amyloid beta a therapeutic target. But these efforts have thus far remained fruitless. This includes a monoclonal antibody drug that was approved by the FDA in 2021 that was used to target these amyloid beta accumulations, but the clinical results have been very lackluster. And so it's called into question as to whether or not amyloid beta is indeed pathological. It could be that amyloid beta is in fact protective in nature, in much the same way that cholesterol is in the vascular system. And we know that cholesterol is the target in modern medicine because it's the gradual accumulation of cholesterol within the arteries that causes an obstruction. Little blebs break off from these atherosclerotic lesions, can form thrombi, which get lodged in the brain and cause stroke. And so cholesterol gets targeted. But everything we know about cholesterol is that it is a membrane-stabilizing anti-inflammatory molecule, and the process of cholesterol accumulation in the arteries occurs over decades. And it's probably something the body is using to stabilize inflammation, to prevent something like an aneurysm, bleeding internally, which would be an acute risk to life and health. And so the body will just keep depositing cholesterol to stabilize inflammation. Clearly, it's a stopgap measure. It doesn't resolve anything fundamentally. But because we're not dealing with the underlying cause of why the body is synthesizing cholesterol in the first place, i.e. the inflammation, the body will keep doing it. So likewise, it seems the brain could be producing amyloid beta to protect itself from toxic metabolites or whatever is occurring in the brain that's causing the inflammation in the first place. So no surprise that just targeting amyloid beta doesn't seem to make much difference. There's also plenty of cases out there of people that have amyloid beta but don't express any symptoms of dementia. There's actually a number of notable cases. So it really has thrown into question this whole notion that amyloid beta, while generally a feature of Alzheimer's disease and dementia, its accumulation within the brain, it doesn't mean it's necessarily pathological. And so targeting it specifically could create some unintended consequences. The other element is what happens within the neurons themselves. And this is two other proteins, tau protein and alpha-synuclein protein. So the tau protein, these are forming these neurofibrillary tangles within neurons. They're comprised of the twisted fibers of tau protein that normally maintain the cytoskeletal structure of neurons, as well as modulate the activities of microtubules within the axons of these neurons. And what happens is that hyperphosphorylated tau proteins pair with other threads of tau and cause the formation of these tangles within the neurons. And it causes the microtubules, which are essential for communication within neurons, to disintegrate. It destroys the cytoskeletal structure of the neurons themselves, and it results eventually in cell death. And then there's also alpha-synuclein. So like tau, it's an important component of normal, healthy neurons. It plays a role in regulating neurotransmitter release and also helps to modulate DNA repair processes. But despite these normal, healthy functions, it's been shown to accumulate, aggregate as insoluble fibrils that are found in diseases like Parkinson's and Lewy body dementia. So like amyloid beta, tau, and synuclein, they have normal healthy functions, but they're being produced in excess. Their function becomes deranged, and this results in cell death. So in the early stage of Alzheimer's, the neurofibrillary tangles and the plaques, the amyloid beta plaques, begin to develop in a part of the brain called the medial temporal gyrus. This includes the hippocampus and major portions of the olfactory system. Now, if you look at where the olfactory system is, it lies immediately adjacent to the nasopharynx. So if you just imagine the top of your nose, the very tippy top of your nose, there's a little bone that separates it from the brain called the cribriform plate, and on the other side of that plate is the olfactory region of the brain. And this is where the pathogenesis of Alzheimer's disease begins to occur. So it progresses from the olfactory region upwards into the cerebral cortex. resulting in a significant loss of neurons, the loss of synapses between neurons, and a diminishment of various neurotransmitter systems, including acetylcholine, norepinephrine, serotonin, that are needed to maintain the higher cortical functions within the brain. Now, one theory, kind of hinted at it, that is responsible for the pathological changes in Alzheimer's is related to the activities of the cerebrospinal fluid. So this is a fluid that's generated by the choroid plexus in the brain. It flows down around the cerebellum, the back portion of the brain, down to the spinal cord, and then back up the other side of the spinal cord into the subarachnoid spaces that separate the cerebrum from the skull. Right? So our brain, our spinal cord are basically floating, bathed in the cerebrospinal fluid. And it has a really number of important roles. It serves as a shock absorber, right? So as you move around and you bang your head, you bump into things, your brain, your spinal cord isn't smacking against its container, against the skull, against the spinal column. It's held in place. But the cerebrospinal fluid also serves as a medium for the exchange of nutrients and wastes. So metabolites generated from normal neurological activities are dumped into the spinal fluid and then shunted primarily through the olfactory region of the brain through this cribriform plate, where these toxic metabolites that are just produced by the brain through normal cellular processes are picked up by the local lymphatics that supply the nasopharyngeal region, so the upper nasal part, the upper nasopharynx, and drawn away from the brain. So this is a really important issue because the only way for your brain to get rid of toxic metabolites is through this shunt that is located in the nasopharynx. And with aging and other pathologies, there's a gradual, what we call ossification or calcification of this cribriform plate. Like if you look at it, it looks like a sieve, this little bone that separates the top of your nasopharynx from the brain. It looks like a little sieve. It's filled with little holes. It's penetrated by lymphatic tissues. It's a really active portion of the blood-brain barrier. So all of the nutrients and toxins that might be entering into the brain are prevented from doing so by this blood-brain barrier for the most part, unless they're fat soluble. Then of course they can't just passively diffuse into the brain. But if they're like amino acids, they have to be actively transported into the brain. And it's important because these amino acids are used by the brain to synthesize neurotransmitters, and you can't have a whole bunch of just random amino acids just flooding into the brain because it'll affect neurotransmitter synthesis. So this cribriform plate plays a really important role as part of the blood-brain barrier, but also allows for the discharge, the shunting of the cerebrospinal fluid out of the brain, carried away by the local lymphatics, and to essentially clean the brain. And as we age, this cribriform plate becomes ossified. It becomes blocked in its function, particularly if you have like chronic sinus issues. And I'm going to get into this. It could impair the flow of cerebrospinal fluid being taken up by the local lymphatics. And if there's any backlog there, then there is a backlog of toxic amino acid residues that are just generated normally from normal metabolic processes within the brain. And they're toxic, they're inflammatory, and it probably results in the formation of amyloid beta in the interstitial spaces to protect the neurons. This is this protective function of amyloid beta. And this continuing aggregation of proteins within this olfactory region of the brain results in the progressive formation of these plaques, and then eventually leading to the accumulation of tau protein, resulting in these neurofibrillary tangles that damage and kill these neurons. So this gives rise to the thesis and supports the notion that there's some impairment within the clearance of metabolite-laden of toxins within the cerebrospinal fluid that creates a backlog in the olfactory region of the brain adjacent to the cribriform plate and allows these toxic metabolites to accumulate and cause damage to that portion of the brain, and then it just progresses and gets worse from there. So apart from that, the balance of evidence suggests that there are multifactorial elements to the development of dementia and Alzheimer's disease. So while this is an important physiological factor in the development of Alzheimer's, we need to acknowledge that it probably relates to like many different factors that accumulate together. Right? So we're talking about inflammatory responses, neuronal toxicity, also things like insulin signaling, impairment of glucose metabolism, impairments of the blood-brain barrier, and I'm going to get into these things, also impairments of cerebrovascular function. So dementia and Alzheimer's disease appear to be primarily modern diseases. They're not diseases that we see in in hunter-gatherer indigenous populations, despite the fact that they have a modal age of death very similar to the modern human, the 7th decade. And it results from the combination of different factors: genetic, vascular, infectious, immunological, environmental, and also diet, nutritional. So the genetic factors, I'm not going to get into any great detail, but there certainly are some people, about say less than 10% of all people diagnosed with Alzheimer's have a rare form. It's an early onset form of Alzheimer's, typically occurring between the ages of 30 and 60. It's linked to a 3 single gene mutation, including amyloid precursor protein, presenilin 1 and presenilin 2, and its mutations that play a role in the breakdown of the amyloid precursor protein and then the generation of these amyloid plaques. That is almost not the case in most people. So this is the particularly severe form. It's definitely genetic, and we have no real way to treat it at this point. There's another genetic risk factor. It's a variant of the apolipoprotein E gene, of which there are 3 types: APOE, epsilon 2, epsilon 3, and epsilon 4. And so you can be a carrier of the APOE allele, and it can increase your risk of Alzheimer's, but it doesn't mean you're necessarily going to get Alzheimer's. Okay, so you can be a carrier, and if you are, it's not a death sentence, but it does mean you probably need to spend more time focusing on preventing this issue. There's a clear correspondence between Alzheimer's and vascular disease. It's a long established relationship. So you just think about blood flow to the brain and impairment of blood flow. This will lead to a type of dementia. And it's mostly related to just atherosclerosis. So it is linked to cardiovascular disease and metabolic syndrome, this progressive thickening of the vascular walls that occludes and slows down blood flow to the brain. And it's also facilitated, like the accumulation of cholesterol, by the accumulation of this amyloid beta within vessel walls. We know what causes this. We can look at the risk factors: obesity, diabetes, smoking, hypertension, dyslipidemia, a history of stroke. They all significantly increase the risk of developing dementia. That's why sometimes Alzheimer's disease is described as type 3 diabetes, because it's linked to the same etiological factors as adult onset diabetes. Interestingly, midlife obesity seems to increase the risk of later cognitive decline. So when you're kind of heavy, overweight in your 40s, 50s, and 60s. But if you are carrying extra weight at older ages, in your 70s and 80s, it appears to be protective. And we can understand this in the context of Ayurveda, that if you have a healthy amount of kapha as you age, it seems to prevent a vata-related disease, which Alzheimer's definitely is. There's also a strong correlation between Alzheimer's and brain glucose. So impaired glucose levels can alter brain cell function. And this can result in the initiation of glutamate synthesis. This is an excitatory amino acid, and that can in turn alter the synthesis and metabolism of acetylcholine. And it appears that the areas of the brain that are highly vulnerable to glucose deprivation are the same regions of the brain that are affected by Alzheimer's. And it's a little ironic because, we think that probably most people are over-consuming sugar and hence are exposed to high levels of glucose in the brain. So the issue is one of reactive hypoglycemia, because the body doesn't like to maintain high glucose levels. And the higher the glucose levels are in the body, the more insulin is going to be produced to bring those glucose levels down. So this is what happens, is you eat a bunch of sugar, it floods into the brain, the body releases insulin to drive that sugar into storage, thereby depriving the brain of that glucose. So it creates this kind of roller coaster effect where you have temporarily high blood sugar, high brain glucose, and then low blood sugar, low blood glucose. And it's this sort of consistent pattern that can happen over the period of a day or several days or entire lifetime that seems to facilitate brain damage and as a result increases your risk of dementia and Alzheimer's. There's a very strong correlation between gut health and Alzheimer's disease and dementia. Number one, alterations to the gut microbiome have been shown to increase gut permeability. This leads to systemic inflammation, which in turn impairs the blood-brain barrier. And we can think about like the function of these semi-permeable membranes in the body that like the gut barrier. It mediates the health of the blood-brain barrier. We see this throughout the body. It's kind of a holographic notion. Think about the liver. What the liver does, it's primarily responsible for metabolizing toxins and excreting them so they can be safely removed from the body. Well, every single cell in the body has a little liver called an endoplasmic reticulum. And the function of that endoplasmic reticulum is regulated by the larger function of the liver itself. So likewise, the selectively permeable function of the blood-brain barrier is a subset of the gut barrier, of the intestinal barrier. So when that becomes compromised, the blood-brain barrier in turn becomes compromised. And so this is a clear correlation that's been observed in traditional medicine. Like in Ayurveda, for example, the risk of dementia and Alzheimer's is directly correlated to gut health. And it's been described that way for thousands of years. It's something we are only just discovering in modern medicine. What's interesting is that by the age of about 70, nearly 60% of adults have a leaky blood-brain barrier. And this in turn can be correlated with a leaky gut barrier. It's also important to note that bacterial amyloids can be generated in the gut, and they can prime the innate immune system to enhance an inflammatory response to amyloid beta within the brain itself. So the brain becomes triggered by the production of these bacterial amyloids to the amyloids that are being produced within the brain, creating this inflammatory response. Another really important factor in the development of dementia and Alzheimer's is oronasopharyngeal and dental infection. So this relates to what I mentioned earlier about the function of the cribriform plate and how the local lymphatics of the nose and sinus are responsible for removing the metabolite-laden cerebrospinal fluid away from the brain. So when there is some chronic infection in the nose and the sinuses in the mouth, it significantly impairs the function of these local lymphatics. Not only that, but it appears that the infection could move into the brain or could stimulate inflammatory responses in the adjacent regions of the brain. So we know, for example, that the neuronal degeneration that we see, it's in the brain, it's accompanied by an increase in the concentration of what are called pro-inflammatory cytokines. And these same cytokines are also found elevated in the mucosa of patients with chronic sinus infection, chronic nasal infection. There's also research showing that people that have periodontal disease have a significantly higher risk of dementia. And we've even found the bacteria that are isolated in gingival disease and periodontal disease has also been found in the brains of patients with Alzheimer's disease. And one very clear thing is I work with patients many years with this issue is that when they have chronic rhinosinusitis, it's typically accompanied by significant impairment in cognitive function. And if we can make improvements in their oronasopharyngeal health, resolve those chronic sinusitis, chronic rhinosinusitis issues, there's usually an improvement in cognitive function after treatment. And that's also been observed in patients that have undergone endoscopic sinus surgery for nasal polyps. They tend to exhibit a clinical improvement of cognitive function after treatment. There's also a link between Alzheimer's, dementia, and spirochetal disease. So Alzheimer's could be caused because of a systemic spirochetal disease such as Lyme or syphilis. Now, syphilis is well established as a cause of dementia. It's been shown to promote the same accumulation of those amyloid beta plaques, neurofibrillary tangles, and tau protein. And it could be that the amyloid beta, once again, is being generated as part of an immune response to microbial pathogens that have found their way into the brain. So the brain is trying to protect itself from these pathogens and producing the amyloid beta as a result. And these little sneaky bacteria, the spirochetes, they can pass through the blood-brain barrier and then enter into the brain, where they gradually multiply and they produce a biofilm that activates what are called toll-like receptors, as well as pro-inflammatory cytokines. And then this ends up resulting in the production of amyloid beta and then neuronal damage. So syphilis and specifically Lyme, which is not as prevalent here on the West Coast as it is in the eastern portions of North America, it's increasing in prevalence here, so it is worrisome, is also associated with the development of dementia and Alzheimer's. And so likewise, viral infection. So viruses may contribute to Alzheimer's and dementia. It's well established that herpes simplex virus plays a role. Also HIV, the human immunodeficiency virus, can also play a role. These pathogens can pass through the blood-brain barrier. They can cause neuronal inflammation, lead to the production, once again, of amyloid beta. And most recently, as we just made our way through this pandemic, it's been shown that SARS-CoV-2, so the COVID virus, has been linked to an increased risk of dementia and Alzheimer's. Specifically, it appears to be the spike protein. It's been shown to damage the integrity of the blood-brain barrier and alter its function. And this then allows the virus to enter the brain through these olfactory pathways. And so it also gives rise to concern over vaccination as well, because what these mRNA vaccines were doing is generating spike protein, a non-infectious spike protein, but nonetheless generating spike protein, which was then used to prime the immune system against spike protein and hence the virus. The problem is that if the vaccine mediated production of spike protein doesn't diminish relatively quickly, that if it persists, then it could be contributing as well to this impairment of the blood-brain barrier, possibly leading to issues around Alzheimer's and dementia. So, it's kind of hard to judge it either way, because if you didn't get the vaccine, then you're exposed to the risk of COVID and spike protein, out of control synthesis of spike protein from viral infection, or a more controlled dose of spike protein from the vaccine. So it's hard to say which is better or worse, except that the epidemiology suggests that you're probably better off getting the vaccine overall, at least on a population basis. But it isn't much solace for those of you that have been vaccinated and have suffered issues regarding impairments in cognitive function. It probably relates to this dysfunctional role of spike protein. Also, there's a strong correlation between environmental factors and the later development of Alzheimer's disease and dementia. Just exposure to traffic noise and pollution. This has been linked to a higher risk of developing dementia. There's one interesting stat that I came across recently, is that if you live within 1 mile of a golf course, it increases your risk of Parkinson's by 126%. And that is definitely related to all the herbicides and pesticides that the golf course is using to maintain those pristine greens. It's also poisoning the local groundwater and affecting people well beyond that 1 mile radius. So it's just a small example. Can you imagine one intervention like that is increasing the risk of Parkinson's by 126%? That's nuts. It should be outlawed. I'm going to share my opinions on golf per se, but it certainly doesn't resemble anything like the traditional, golf courses when golf was first invented, hundreds of years ago, in a cow paddy in Scotland. Now it's these pristine greens that are highly cultivated, just brimming with herbicides and pesticides, intoxicating the local environment, increasing our risk of Alzheimer's and dementia. It makes no sense. There's also a correlation between the exposure to inorganic aluminum and Alzheimer's disease. Aluminum is not a natural part of the diet. It's something that's definitely an artifact of the modern industrial world that we live in. And aluminum is known to interfere with essential enzymes that are needed to metabolize glucose for energy production in the brain. It causes the destruction of the blood-brain barrier, and alters the function of certain amino acids. There's also some research suggesting that fluorine in water enhances the absorption of aluminum that's found within the water supply. So it does put into question the sustainability of water fluoridation programs. I know it's a controversial issue. There's a pro and an anti. On the pro side, of course, it is thought that it reduces the incidence and frequency of dental caries, particularly in children. But then on the other hand, it seems to be correlated with an increased risk in cognitive issues and then also things like hypothyroidism. And then there are important factors as it relates to nutrition and the development of Alzheimer's disease and dementia. This is among the most important modifiable risk factors. All those other ones are hard to. I mean, you can prevent getting bitten by a tick, but sometimes it just happens. You did all your due diligence. You're living in a polluted environment. There's not much you can do about that. But your nutrition, that's something that you can really take control. And there's lots of different philosophies and approaches around diet and the reduction of dementia risk. There's the Mediterranean diet, there's the DASH diet. Both of those and the hybrids of those have been shown to promote better memory and thinking skills. There's been studies like a randomized crossover trial of a modified ketogenic diet has been shown to improve daily function and quality of life in patients clinically diagnosed with dementia and Alzheimer's. And the thing is that while there's all these different diets, you see this illustrated in my book, Food is Medicine, I don't recommend one particular diet. I'm not about a dietary fad. There's just one type of diet because we're all different depending on our age, our gender, the climate we live in, our ancestry, disease burden. There's going to be different diets that are appropriate for different people. But the key element in all the diets that are healthy and promote benefits is that they maintain an avoidance of sugar and refined sweeteners. They avoid refined fats such as processed seed oils and other processed foods. So, what we call the standard American diet certainly is going to increase your risk of dementia and Alzheimer's. So if we avoid all of those factors, all the junk food, the refined food, the processed food, get it out of the diet, whether it's a vegetarian diet, a ketogenic diet, a Mediterranean diet, whatever it is, it's going to be much better and it's going to have this benefit in terms of reducing your overall risk of dementia and Alzheimer's. There's been some controversy around meat consumption. Certainly in those that regularly consume processed meat, such as bacon, sausage, deli meats, there is a clear correlation of an increased risk in dementia. But while there is this clear link between processed meats, the link between unprocessed meat isn't so clear, with research being inconsistent. Sometimes it shows no significant association. Sometimes it even shows a protective effect. So a lot of it relates to how we prepare the meat. So once again, you want to avoid regularly consuming processed meat such as bacon. Every once in a while it's not a problem, but consuming it every day is not a good idea. You want to make sure that you prepare meat in such a way that isn't damaging it, causing it this what's called a browning reaction. It's a Maillard reaction. It results in the production of what are called advanced glycation end products. So high heat cooking, where you're grilling, frying the meat. All those flavor compounds, we like them for a good reason because they're delicious, except that they're toxic, they're cancer causing, and they can be linked to the later development of dementia and Alzheimer's. Consuming excess sodium, certainly in processed meats, is a factor here. There's also some concern about the production of what's called trimethylamine N oxide, or TMAO. This is derived from the metabolization of L-carnitine and choline by the gut microbiota. So if your gut microbiota is off and you're consuming high levels of meat, then you can produce this metabolite TMAO. And this is linked to vascular damage, disruption of the blood-brain barrier, and neuroinflammation. So, this probably isn't so much of an issue around the meat per se, but our gut microbiome. So you want to pay attention to the health of your gut microbiome. Make sure you're consuming probiotics and eating lots of prebiotic foods. The so-called carnivore diet that people are eating, they get good results short term because they're not being exposed to some of the anti-nutrient factors found in things like seeds, nuts, grains, legumes. But to to deprive yourself of these prebiotic fibers and all the antioxidants and anti-inflammatory substances found in plants. It's not just my bias as a herbalist that says it. There's clear evidence that following such a diet over a longer period of time is going to increase your risk of dementia and Alzheimer's. And then also just over-consuming iron, mostly unprocessed heme iron. It results in the production of reactive oxygen species. So you want to be judicious in your consumption of iron-rich foods. Gluten is positively correlated with Alzheimer's disease. There's an association between Alzheimer's disease and celiac disease, as well as non-celiac gluten hypersensitivity. It impairs cognitive function, primarily by promoting nutrient deficiencies, by causing systemic inflammation, and impairing serotonin synthesis by inhibiting the absorption of tryptophan. One of the tricky things about gluten is that if it causes gut problems for you, you're one of the lucky ones, right? Because a lot of people can go and eat bread or whatever, and they don't have any problems. But it is a silent killer. It's causing damage to the brain that is not being experienced or felt until it is too late. Alcohol consumption, honestly, it's the worst drug. There's so many better drugs than alcohol. Even low to moderate consumption of alcohol has been shown to damage the frontal lobe of the brain. And what does that equal? That it's about a pint of beer or a glass of wine, maybe 3 times per week. So if you're having that more than 3 times per week, it's probably causing some degree of brain damage. And then also essential and accessory nutrient deficiencies, vitamin D deficiency. This results in a 53% increased risk of developing dementia. Polyphenols, I mentioned them earlier, like flavonoids found in things like turmeric or black cherry juice. They exert a systemic anti-inflammatory property and also an effect localized in the brain. It's been shown to improve verbal fluency, short-term memory, and long-term memory. So you want to make sure you're consuming a sufficient amount of those polyphenols and flavonoids. But you can go overboard with it, right? Like chili is a good source of the different polyphenols and flavonoids. But if you consume over 50 grams of chili, when some people do in some places of the world, it has been shown to be linked to or to enhance cognitive decline. And this is this hormetic relationship, this J-shaped relationship, that there's a sweet spot for antioxidant consumption. Too little, it increases your risk of disease, and too much, it likewise does. So you need to be judicious in your consumption of these things. Likewise, coffee. Coffee is good in small doses, 1 to 2 cups a day, good for the brain. But consuming more than 6 cups a day is associated with a 53% increased risk of dementia and atrophy of the brain. And then, of course, food additives. Food additives have been implicated in the development of Alzheimer's. I know there's some controversy around MSG, but that's one. Artificial sweeteners such as aspartame. In the MSG is glutamate. This is a well-established excitatory neurotoxin. It's been shown to promote amyloid beta accumulation. The higher cumulative intake of artificially sweetened soft drinks is associated with increased risk of all-cause dementia and Alzheimer's disease. That aspartame, it consists of 50% phenylalanine, 40% aspartic acid, and 10% methyl ester. And the phenylalanine has been shown to disrupt the function of the amyloid precursor protein, and as a result, contribute to its pathology within the brain. So let's briefly talk about, in the last 10, 15 minutes here, about some holistic interventions for dementia, things that you can do. I talked a little bit about diet, so of course that's really important as well. So the key thing is prevention, because once the symptoms of dementia have arisen, it's probably too late, right? So we should all be on this path. If you're like my age, I'm 56 years old, I am making sure to take active measures to prevent this. And that includes, modifiable risk factors such as my diet, exercise, social connections, etc. So let's talk about some general things. So, general anti-aging measures are going to be helpful here because there's a strong correlation between chronic disease burden and the development of dementia and Alzheimer's. Remember, it's linked with metabolic syndrome, cardiovascular disease, diabetes, right? Central obesity, particularly in middle age. Those are all things that you can address now to resolve them or to prevent them, and they will be helpful. You want to make sure that you're promoting good circulation, you're preventing oxidative damage. And then you can employ measures that we would describe in the various different medical traditions, like rasayana therapy in Ayurveda, Fujing therapy used in Chinese medicine, or tropho restoration as described in the Western herbal tradition. All those different measures, which I can touch upon, are going to be helpful. You want to make sure you're addressing chronic infection. So if you're carrying chronic infection like periodontal disease, including like a tooth and gum disease, if you've had a root canal, for example, that can be a significant risk, right? Because you're keeping dead tissue in your mouth, right? And the bacteria can accumulate around that. So particularly if this root canal is causing you problems, you're better off just to get it out than keeping dead tissue in your mouth. Resolving things like chronic rhinosinusitis, chronic Lyme disease, etc. There's a strong association between a lack of mental and physical stimulation